Thank you for tuning in today to talk about falls and older adults. Falls are the number one cause of death in many different analyses. If you read, you'll see, because it's not always the fall that's listed, but the fall that triggered it, or the hip fracture, or falls are just horrible. So when we think of how do we prevent them, they're almost so difficult. When you think of who falls, well, everyone's at risk for a fall, honestly. And especially with memory loss, there's so many reasons people fall. So I want to talk about a few of them that go undetected. One is the urinary tract infection. Because your kidneys could get a little weak, your back could hurt, you could fall. And it is often listed as a cause in the ER. So someone leaning maybe, or someone who's had a recent fall and they're weak, always check the urine. Number two, I would say lack of exercise and not getting the order for the physical therapy. So important. If you go to see your doctor, you have a house call doctor, you're blessed with a house call doctor. Ask them, when can I have physical therapy in the home? Can they come once a week, twice a week? Can they give me exercises? When is it time for me to renew that? Because I'm feeling a little unsteady. Those kind of questions are super important to ask. Getting a recumbent bike is really critical. Getting balancing techniques are super important. Wearing a pendant if they're living alone, or even with a caregiver, a pendant's really important. When I say a pendant, I mean an emergency call system of some sort. The Apple Watch is one too, and there are others. Having any kind of device that you could interface with, or motion detector, those are important too. None of these are really at the core of preventing them, but detecting. Detection's equally as important. If someone hits their head, please send your loved one to the hospital. You never know if there's a bleed, or we just don't know. So any sign that the fact that they could have hit their head in any way is so critical. Having a pulsed, P-O-L-S-T as in Tom, on the refrigerator, or a DNR, or some important 911 information is critical too, because if they do fall, you want to be able to hand that to the emergency personnel when they come out. What if your older adult is falling a lot at midnight, or in the middle of the night, or saying, gosh, I was in the shower and I felt, we're in the shower at 12 o'clock. If things are not adding up, maybe there is some alcoholism. Maybe there is some drinking. Maybe there's some inappropriate usage of sedatives. We don't know. But if someone's going to the hospital a lot and they're falling at odd times, or there's bottles in the trash can, or you detect slurring, really research it, because you don't want to mix. For example, we don't ever want an older adult to mix Ativan, a sedative, benzodiazepam with alcohol, or we just don't want to mix things, and we don't want someone to die of that. And again, they could be falling and the ER could not be noticing. Sometimes the ER notices, sometimes they don't. So really digging into the cause and what are some unspoken, unknown causes when you're doing your research online, or looking into geriatricians, talking to them and asking them questions. Ask what are really the core at these falls, what really causes them, because a lot of times older adults don't want to talk about the real reason. So I encourage everyone to have open communication with their doctors, with nurses, with family members, and try to get to the core of why someone's falling. Have a wonderful weekend, and thanks for tuning in to Assured In-Home Care. We are very thankful for your support.